Hey guys, this is Dr. Sean over at FORTIS. So this is week 6 for Medical Terminology 105. And what I'm doing is we're going to do a speed run of week 6. So let's go over it. So I have up here the can I see my, there we go, there's my cursor, and we have like basically some things that we're going to be looking at this time is the marvel of creation and reproduction. A lot of reproduction stuff. Now down here, if we see that there's the discussion page there, I want you to realize something when we're looking at abdominal pain. In medicine, all medicine, any female of childbearing age that has abdominal or low back pain should be considered pregnant until proven otherwise. And here's why. Because things like ectopic pregnancies, which is a pregnancy that occurs outside of the uterus, or like the implantation starts outside the uterus, because the fertilization of the egg happens actually somewhere in the fallopian tubes. Remember, there's that thing that you have like the uterus like this, and there's these two like tubes that come off the edge, and they have like little hands like this, and they hold on to the like this to the there's the ovary, right? And here's these little fimbriae, they're called, little fingers go like this, and they kind of like guide that little egg all the way along the inside of that, and that's where it's fertilized. So this one here asks, what's the correct name for female reproductive part that leads from the ovary to the uterus? I just told you. It is called either the fallopian was the name of a person, right? Or it's the uterine tube, okay? And it goes, it's an open tube, smooth muscle with little cilia that help the little egg go all the way over and implant somewhere inside the uterus. Now remember, if it doesn't get fertilized and it doesn't send out some chemicals and some hormones and stuff like that, and then it lands on the surface of the endometrium, that's the inside layer, a little soft layer of the inside of the uterus, and doesn't implant because it's not fertilized, so it gets expelled through menses, right? Menstruation. Discuss the role and importance of this reproductive. Now we have a thing called tubes tied, where women that can have those tubes, the fallopian tubes, uterine tubes, tied off or cut and turn in a knot or whatever. They usually I don't even know if they snip them. I don't think they really turn them in a knot. They probably just clip them shut, and that keeps the egg from getting to the uterus, right? Therefore, it never implants. Eggs that are ejected from the ovaries will become resorbed by other parts somewhere else in the body. In addition to your original post, sure to provide meaningful. See that meaningful response? That means like better than I agree, or that's good, whatever. At least 2 of your peers by the end of the week. Peer responses explain how another part of the female reproductive system functions. Explain how another part of the female reproductive system functions in conjunction with the whole system. So you can add anything. You can even go back as far as saying, like, you know what? I want to talk about the hypothalamus. Remember the hypothalamus? That was part of the brain, but it's also an endocrine organ, and it releases some hormones, and it releases some stuff, or the anterior pituitary or posterior pituitary or whatever, right? You can talk about any of those things related to that, and I will put in my posts some of that as well. So let's go back up here to modules really, really quickly and go all the way down to week 6. Remember, this is already 3 minutes in, man. So marvel the learning objectives or learning outcomes for this one. Apply terminology related to urology. Urology has to do with the ureters, the urinary bladder, the kidneys, the nephron, the glomerulus, all of that stuff, the pyramids, and all the pyramids, which are not just in Egypt, but or South America, but they're also inside the kidney, right? The inside of the kidney. Now think of like if you slice a tomato, you look at the slice of tomato, and it has these very, very similar looking. And in traditional medicine, often kidneys and tomatoes are good for the kidneys. They are because they have a lot of fluid and a lot of water. Utilize medical terminology related to sperm. Okay, sperm is the sperm cells. OO would be the ovum or ovaries. Ovaries make ovum or ova, right? Spermato. O is that connector. Remember that. And then genesis, to create. Okay, creation of sperm. Okay. Apply terminology related to obstetrics and gynecology to the structures and functions of the female reproductive system. Obstetrics, OB. Your OB, GYN, OB-GYN, right? OB, obstetrics, and gynecology. Obstetrics has to do with babies, and your OB, and then your gynecologist is the lady doctor, the doctor that looks at lady parts, right? And all that stuff, because men don't go to gynecologists, generally. Utilize medical terminology related to pregnancy, okay? Development of the fetus and childbirth. So remember, we have the embryo, the fetus, the neonate and stuff like that. Now, as you go to childbirth, you also have like the neonate, NICU, neonate ICU, intensive care unit. Some of you will probably be working in those someday. And then you have like pediatricians or pediatrics. You would have toddler levels and stuff like that, and child and adolescent and then adult. Apply correct medical terminology related to the structure and function of the breast. So the breast in the male and the female is quite similar. However, females have changes that occur when they go through puberty. And those changes generally are changes with the structure, obviously. But there's glands inside there, and those develop differently. There's fat tissue as well. It's very interesting. If you look at other animals, they generally don't have breast tissue their whole lives like we do. You know, like as soon as you become, once you start to develop as a young girl into a woman, then you end up having this breast tissue which stays your entire life. And they do get bigger when you become pregnant, and they become bigger when you breastfeed. So that's a thing. And there's a whole lot of other interesting physiological things that occur with that stuff too. Communicate accurately with medical terminology related to obstetrics, gynecology, and male reproductive system in written and verbal forms. Interestingly, because there's a gynecologist and an obstetrician, we don't have a male reproductive system doctor. There's not like there is a proctologist, but that's looking in your bum, right? And there's a urologist that's looking in your pee, right? And so males would have to go to those guys or gals or whoever they are to have things checked out. So your prostate, not prostrate means to lay down. A prostate exam is actually for men, right? Prostate is a gland similar to other glands that are what are called homologs to the female reproductive system. Reproductive system, male and female, discuss interactive lecture, case study, Daniel Gray and Shafira Khan. Okay, probably has to do with becoming pregnant or something like that. This is table of contents. Go past that. This is creating life. There we go. There's the male system right there. So interesting parts of the male system. Check it out. Notice we have in common, male and female, is you have the rectum, anus, and all of that stuff. It's all exactly the same. The urinary bladder, quite similar, except for the male urinary bladder goes through this guy here, which is the prostate, if you can see that there. And then there's little bulbal urethral glands and Cowper's glands and all these other guys through the urethra. Urethra is through here, and ureter is up here. Now look at this guy here. This one goes all the loopy all the way up and above is called the spermatic cord, or you could call it the vas deferens, which is the great difference, is what it actually means in Latin. Here we go past that to growing new life. Here we talk about there's the female side of the thing. Notice here, anus and rectum all exactly the same. There's the urethra. Right, for females it's shorter, obviously. For males it was longer. There's the urinary bladder, and it doesn't show it here, but the ureters would come off here and go up this way into the back. Ureters, remember, are just two tubes that go loopy-doop up into the low back and behind the peritoneum. That's all the coverings of the guts, and goes to the kidneys. The kidneys filter what? They filter the plasma, right? Not really blood. If you have blood in your urine, that's a bad thing. But you have plasma. Plasma is the fluid part, and it pulls out like salts and water and stuff like that. We want to make sure all that stuff is balanced. Okay, knowledge check on this one here. Primary male reproductive organ responsible for producing sperm is the testes. Urethra is the traveling. Vas deferens is a tube. Right? Too fast, man. In females, this is where the fertilized egg implants and develops. That's going to be uterus. There we go. We did get that one right too. I'm going over this really quick, and then we're going to be done. Right? Primary hormone produced by male in the testes is going to be testosterone. See how fast we can do these, right? And do them right. Which structure produces the ova in the female? And that's going to be the ovary. right? Fallopian tube, uterus, that stuff. Vagina is the tube that goes in, right? The tube that connects the testes to the urethra. Testes to the urethra. So from testes to urethra there's the epididymis, which is right next to it, and the vas deferens. So we are going with that. And we got it, because epididymis is right next to the testes down there. That's where you get something called blue balls, and that's an inflammation of that from not being expressed. So it's a epididymitis, actually. It can be bacterial, which is bad. Female structure known as the birth canal. There we go, the vaginal canal, or the birth canal. It has many purposes, right? Structure surrounds the urethra and produces fluid that nourishes sperm. So sperm, we know it's male, and it's got to be not the bladder. The bladder is upstream from that. Epididymis, remember, that's done by the testes. Seminal vesicle is a different kind of vesicle. Means little sac, so it's a little tiny place where there's something made, and then we have the prostate gland. Through, okay, produces through the structure surrounds, okay. Produces where egg mature is released from the ovary is called, process where mature egg is released from the ovary is called ovulation. Fertilization is when they connect, implantation is when it lands, and menstruation is if it doesn't land and it's been not fertilized. Which structure stores the mature sperm in the male? Oh, here we go. So notice they didn't say the testes, which is good. That helps us out. Not the urethra. Okay, that's where urine goes through. Vas deferens is a traveling point as well. Prostate has other things, and this is the epididymis. We just talked about that one, epididymitis. Let's see, come on, this has got to be almost done with these, right? Thick layer of thick muscular. When you ever hear muscle, think of myometrium. Endo, inside, perimetrium, around. Cervix is actually the opening. 10 out of 10, there we go. That's it, all I wanted to do, 11 minutes for the speed run. There's a lot more to do in this one. Take your time, read through it. Remember, it's due on Friday night, right? Because we turn grades in Saturday morning, usually, something like that. So if there's a problem, email me. You can go on campus and contact me. Some of you we've already talked to. There's other things going on. So take good care, do good things, and we'll see you. And I'm proud of you guys for doing so well in this class. I appreciate you. Talk to you later. Take care. Bye.